In the home, you form a special bond. And I think that really is unbreakable.
It's very rewarding as a nurse. It's a lot less stressful than some of the other nursing environments.
I love it, honestly. I wouldn't choose any other field.
I love the one-on-one connection that I had with all my patients and residents. I feel like home health is more of that. I like to have continuity of care, so I like to stay with someone as long as I possibly can.
I really enjoyed being able to make that connection with them and help me to really feel like I'm making a difference in their lives.
I never wanted to work in the hospital because I worked as a tech, and I knew when I became a nurse that ain't what I wanted to do. I wanted to go into the home field. I would also say if you get out of anything what you put into it, and home health is no different.
For me, it's been especially rewarding just to know that you are able to have that close relationship with the patient and family.
But this is a good place to start. It's one of the best companies you can ever work for. So if you start with a good company, what you put into it is what you're gonna get out of it.
I love care options for kids. I love, the fact that if I call, I always get a response.
They're both really prompt and they respond and they walk me through stuff and tell me what I'm doing wrong, how to fix it.
I feel like with care options for kids, they more listen. I feel like the communication is precise.
I really like being able to reach out to people and they respond quickly and are there when you need them to be there.
The care that they show towards their employees, they work with your schedules, they really care about your families because they know if the employees are happy, it's going to show in their work production.
You kind of get a little bit more freedom than you would at a lot of other companies. I don't constantly have to check in with somebody, my schedule's set, I come to work, I do my job. If they need something, they reach out, and I love that.
Any job that I've ever gotten, I always said that the biggest thing was the people. I always prayed for the people and the support, and I was looking for the security and looking to know that I was going to be in a healthy, happy environment. So to get the reference, something so good about care options for kids, I knew it was definitely a good decision.
It has been nice having the flexibility and also just knowing that if there was ever something in my life that changed, care options is there to, work with me. And a lot of the times the families are as well, as long as you're doing what you're supposed to do.
Care Options for Kids is one of the best companies I've ever worked for. Everybody has always cared about me. They've always been there for me and I've always been there for them, and that's why I'm still here.
I did all of my onboarding online and it was very quick. I had an interview on the May 1st and then I was at work on May 6th.
I went through the application process and they got me paired with this really cool 11-year-old girl. So they did education on trach and vent before I went out there. I was honestly really relieved because I knew in home health it was a little different because you're by yourself. So you have access to people that you can call to be able to get help, but really you are the nurse. It's a little more hands-on with those kind of skills. I did online modules for trach and vent, and then I got to go out and I did 3 full shifts with this girl and another nurse so that I can feel confident and comfortable and really get to know what's going on.
It was one of the best hiring experiences because I wasn't left in the dark. I knew exactly what was going to happen next, and I knew, you all also helped me to feel comfortable to work in the home environment.